Dr. Anne Cagliotti from Atlanta told us about the importance of continuity of care.
Continuity of care that we measured is interpersonal continuity, or the relationship between a doctor and a patient over time. And there are several other types of continuity of care in the literature: informational continuity, management continuity. But relational continuity has been shown to have, there's a significant body of evidence that shows that this is an effective way to improve health outcomes and reduce mortality on a population level. And so that's why we focused on interpersonal continuity, or the relationship between one doctor and one patient over time. Well, continuity of care has been associated with a host of salutary health outcomes on a population level, but it has been very slow to translate into practice, and in fact it's being devalued by patients and actually in the literature as well. There was a recent New England Journal of Medicine article that actually suggested we shouldn't have continuity of care. And so because this function of primary care is so associated with positive outcomes, we wanted to develop a practical measure of continuity that could actually translate into real-world practice and offer a framework for implementation in everyday practice. People identify that in large national surveys that they have a usual source of care for their primary care, or a place to go when they have medical needs. A majority of people do say that they have this. However, when we look at continuity of care on a longitudinal level for things like chronic disease management, in our study we found that this is actually very rare, and that only about 35% of Medicaid beneficiaries in 26 states in the U.S. had continuity of care for their chronic disease management. The clinical outcomes that we looked at in our study, which was a secondary data analysis of a large Medicaid claims database, were health utilization outcomes that are proxies for quality of care, and that included emergency department utilization and hospitalizations, as well as total cost of care on both the individual and ecologic level. So my take-home message is that I think we all, as general practitioners, want to have continuity in our practice, that it's not just good for patients, it's also good for physicians. And we hope that this measure offers a framework for us to have some joy in our practice again, and to also be able to see our patients and improve individual and population health.